go ahead and start with the assessment of the heart now. Now, this one, just like every other one, we'll start out with the inspection portion. And first thing we're looking at is basically just the skin, making sure you look at that area where you would find your apical impulse, see if you see it pulsating just by looking at it. Very, very thin individuals, you'll see it very prominently there. Also looking at the nail beds, the skin, looking at capillary refill. These are all going to give you indications as to whether this patient has a good heart function and is perfusing the different parts of the tissues very well. Another thing you want to look for is on the legs, making sure that the patient has good hair growth on their lower extremities. In a lot of cases, patients that do not have very good health or hair growth on the lower extremities, this could give you a good indication that maybe they just don't have enough circulation going to the extremities, and thus that's why they don't have good follicular growth. Also looking at capillary refill on the portion of the nail beds and skin in that area as well. So continuing on. So we're looking at the visibility of the apical impulse to begin with. We want to know exactly where to look for this. Now the heart lies in the part of the chest that we call the precordium. It's just the part of the chest that overlies that heart. Now you would normally find the heart about anywhere from the 2nd to the 6th intercostal space. So that would give you a good indication as to where the heart lies. In medicine, a lot of the times they use the spine to be able to identify where different structures are, such as like a metered ruler, where you would take where the certain organs lie based on that. So if you're looking at it from the spine, you would normally find that at the thoracic vertebra, the 2nd thoracic vertebra, T2. You can very well identify by looking at C6. That is the most prominent bone on the back side in the upper portion there, and then just count down 2 after that, and that would be where the top portion of your heart would start. So it would make sense that I would tell you that the heart lies anywhere from the 2nd intercostal space to the 6th. So the apical impulse most likely would lie somewhere around the 5th or 6th intercostal space. So also another thing about anatomy on the heart is that it's actually reversed to what we saw in the lungs, where the lungs, the apex is at the superior portion and the base of the lungs is at the inferior portion of the body. It's quite the opposite with the heart. The heart's base is actually located at the superior portion, whereas the apex of the heart is located at the inferior portion. Where the heart lies in between both lungs and more to the left side. Thus the reason why we more astutely assess on the left side, because the left lung actually has a little pocket or indentation there where the heart lies. So that is why it's more on the left side, and we assess more on the left side, and we actually are able to feel pulsations more on the left side, just because anatomically that is where the heart is, unless you have some congenital abnormality where it lies on the opposite side. So, moving forward on palpation of the apical impulse. So the way that we do this is we're going to just kind of lie our hand here below the nipple and just kind of try to feel for the apex and feel for that impulse of the apex. Okay, and there I could actually feel it. It's kind of faint. And then we're going to move to the left sternal border here. Now this is where you should feel more of a prominent pulsation, because you have the base of the heart where you're feeling here. And I can feel it very well. And then you want to move to the base, which is the top portion here. And remember, we're looking at about the 2nd intercostal space. And sometimes you may feel some of it on the right sternal border, but at some point, you know, some of the heart normally just stops and ends at the right sternal border, so you may not be able to feel anything. Which is the case here. I don't feel anything. Unless this patient has something like cardiomegaly, most of those cases you would be able to feel it. And then you want to go to the epigastric area here and see if you feel anything. And then you can also feel in the axilla as well to see if you can feel anything there. Okay. And then what you're going to do is you're going to go ahead and locate the area of the apical pulse. Again, putting your finger here, and I know that I use the palms of my fingers here to better assess where the actual apex was. Okay, and when you feel that, you want to go ahead and make a little marking there. And then when you do that, you want to go ahead and measure that from where the sternal border is, which is about there. And that's about a centimeter and a half. Now, you normally, when you're measuring the distance from the apical pulse to the sternal border, it should be about a centimeter. You shouldn't have a very, very wide length between those two, just because then you're talking about the heart lying in a position that is not normal, whether it be because it's enlarged, hypertrophied. I mean, there could be significant factors that could cause that. So that would be the reason why you would want to measure it in the first place. Now, if you have a very, very strong pulse, and you would say that it wouldn't be normal from what you're feeling. It's not a gentle pulse like the way that I feel here, but it's actually pulsating quite strongly. Then you could actually describe that as being a heave or a lift. Now, you want to always use tangential lighting to be able to actually see what, like for example, when we're inspecting, tangential lighting will be able to be useful in order to see if the skin kind of flickers with the pulsations. So you want to, after you assess that area here where you have stated that you can feel the apex the strongest and you've measured, another thing to note is that area that you felt the strongest pulse at the apex, that would be what you would call the point of maximal impulse, or the PMI in this case. Now, when you look at the second intercostal space, now I had mentioned that is where the base of the heart lies. Now, when you're looking at the base of the heart, you're looking to see if there is any thrill. Now, when I talk about a thrill, it can be analogous or similar to what we would call a murmur, and what we would name a palpable murmur. And it's just a vibration that you feel, that you could actually put your palm of your hand on, and you could actually feel just a rush vibration. And sometimes you'll have it and sometimes you won't. But you do need to assess for that, both to the left and to the right sternal border, assessing the base of the heart. Now, when assessing the heart as well, you can go ahead and place your heart over the left sternal border and then the other hand on the carotid artery. And then you want to make sure that the beats that you feel occur at the same time. S1 should be synchronous with the carotid artery pulse. And that is exactly what I feel. You could check it on the apical pulse as well. There should be, if there's a slight delay, that's normal. You're just making sure that you don't have an enormous delay. And that way you know that when the heart pumps, it's going straight up into the cerebral area and perfusing the patient's brain just as long. So we're going to go ahead and stop there with this video. We'll continue with the next one on the percussion.